The cesarean section is the most commonly performed surgery in the United States and the most performed major surgery in the world. It's a surgery that impacts physical function, requiring an intentional rehabilitation plan to support recovery with one condition. The person typically has to recover while caring for a newborn baby. Unlike major surgeries such as a knee replacement, a hip replacement, and even a shoulder surgery, women after cesarean section are offered no such rehab plan after their major abdominal surgery during their hospital recovery. They are cared for by an attentive, kind nurse during their hospital stay who will typically not ask them about the flat bed at home they may struggle getting out of, about the stairs they will have to navigate to get to their bedroom, or about the other children they may have to care for during their recovery. Dr. LaShonda Jones is a physical therapist who specializes in cesarean section recovery and who believes there is so much more we can offer with rehab to improve how someone functions after this major abdominal surgery. She provides virtual rehab, coaching, and personal training for moms during pregnancy and within the first 48 hours after their C-section. She joins me today to discuss the future of cesarean rehab. Dr. Jones, thank you so much for joining me.
Thank you so much for having me. I'm so excited about this discussion.
So tell me a little bit about your practice as it is now. You provide virtual rehab, coaching, training. Tell me a little bit about what you do.
So the virtual space, a space that I was not expecting to be in was such a foreign kind of concept pre-COVID. Now I feel like now post-COVID is more common. People are more, used to it or maybe even seeking it. But I've been in this space probably about the past 5 years. And I came into this space because I realized that, you know what, there's more that I can do outside of the four walls of the clinic, right? And so I worked in the outpatient clinic for about 14 years, and I just felt like there was something calling me outside of that, outside of just working as an outpatient orthophysical therapist. And I'm sure we'll get into all of that. And so now I'm not only able to help one-on-one to women. I help women in a group setting. I work with women all over the world, globally, just educating them about pregnancy, postpartum, how to care for themselves, their bodies, their new bodies that they're coming into in postpartum, and helping them with rehab, both early postpartum care, late postpartum care, meaning moms and women who are finding out about C-section care because, again, no one tells them about it. So working with moms who've had C-sections 20 plus years ago. I work with women and moms for diastasis recti rehabilitation, helping them restore their core and their pelvic floors. Just so much education and really grounding and helping moms become strong all throughout pregnancy and postpartum.
Okay, that's phenomenal. And Dr. Jones, we talked offline. You didn't actually have a pelvic health background in those 14 years that you were a physical therapy. So how did that happen? How did you transition into women's health, pelvic health, cesarean rehab? How did that happen?
I had children. That's exactly how it happened. I had children. And so I have a son who is 10. And when I had him, I was working in an outpatient clinic. So my whole world that I knew knees, backs, shoulders, working with athletes, working with the general public. That's what I knew. I'm not going to say nothing. I knew very little, the very little that they'll teach us in PT school about pelvic health, and outside of like my not continuing education, but the clinical rotation that I did for women's health. Outside of that, I knew not a whole lot. And so I ended up having my son. And so I kind of feel like I was pushed into this world a little bit, even though it was by choice, but pushed in it, meaning I had to learn how to rehabilitate my own body because no one taught me. There was no physical therapist there after I had my son. I had my son vaginally. My son is my oldest. So I had him vaginally, but I had to figure out this mild prolapse that I was now having and feeling this bulge after I had my baby. I was now having to figure out this diastasis recti that I had never heard of ever, even as a physical therapist. Like, what is this? And when I had my son 10 years ago, it was the age of no twisting, no crunches, no sit-ups, no this, no that, but no real direction on how to heal my body. So having to navigate that for my own self. That's how I got into that's how I got into this, because the nerd in you wants to figure it out, right? The nerd in us, meaning PTs, we want to figure it out. Like, how do I rehabilitate myself? And it has to be more than everything I can't do. What about what I can do? And so I got into specializing into diastasis recti rehab, healing my own body. And same thing with C-section recovery. I started to gain a true understanding of the huge postpartum gap that existed in C-section recovery, moms not getting care because there was no PT coming at my bedside when I had a catheter and couldn't stand upright. And I had to go, like you said, walk upstairs that I didn't know if I could or could not. Like, nobody told me anything. And it was just like, whoa, is this what C-section moms and women go through? Because if so, that's a major problem, right? And so I felt the need to fill that gap. So for me, my story is filling the gaps. Seeing where those needs are and then saying, you know what, there's a need for this here, and I'm going to learn more about it. I'm going to do my research about it. I'm going to do the continuing education, whatever it takes to help moms and women not have to go through what I went through. I mean, this is me being a PT and having knowledge about the body. What about the women have no knowledge at all? So that's how I got into it.
So let me ask you this. Did you actually work with pelvic health, women's health patients after your vaginal delivery, before your C-section delivery? Did you make that pivot in your career then?
Yeah, I started making that pivot then. And really what's so funny, Dr. C. Grace, is that I was purely sharing my journey, just being authentic, transparent on social media, just sharing with moms what I was doing in postpartum. I was an orthopedic. That was not my lane. I wanted to kind of get in that lane. Honestly, like I liked women's health, but I felt a bit intimidated by it as an ortho PT. I was like, that's a whole nother world to get into. And so I just simply started sharing my own journey. And so a lot of women was like, wait a minute, tell me more about this, as nobody could ever say a diastasis recti. They could always say that. What did you say? That. I have that. My stomach looks like that. And so that was the beauty of social media, is that me sharing my journey, me sharing the condition and what I was learning, that got me to start to share, to start to research, to start get different certifications and yada, 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 and then get into pelvic health. So that's pretty much how that happened.
So after your C-section, just if you can go back to that like hospital stay, what were you experiencing that made you think, is this what moms have to go through? Like, what turned on the light switch for you?
Honestly, when I was in the thick of it. So first of all, I had an unplanned C-section. So it was not planned at all. When I went into that hospital, my water broke. I was planning to have a vaginal birth. That was my plan, right? So in the thick of it all, I was in utter shock. Okay. So I wasn't thinking, I mean, I'm not even gonna say like, I'm like being all prophetic and, just thinking no PT's coming here. I wasn't even thinking about a PT. That's just being honest, right? I was literally in the shoes of a C-section mom, having this unplanned C-section, everything being thrown at you. You're now insides are cut open essentially. And what is happening? Nobody's really telling me nothing. That's really what I felt. It wasn't until I got home and my husband, and it was the light, that was the light bulb moment for me. My husband said, "Are you supposed to go upstairs?" And I said, "I have no idea. I have no idea what I'm supposed to do and not do." And that was the light bulb moment for me. It was just like, wait a minute. Nobody told me nothing. Like nothing. Even from down to my scar care, like I may have gotten a pamphlet or something like that, but nobody told me truly how to care for my scar. I mean, nothing. And that was the light bulb moment for me. I was in shock because I was like, I just had abdominal surgery, right? I've never had any major surgery in my life, so I had nothing to compare to. But on the PT side of things, I know what it is to have a major surgery and then get rehab. And to not have that and see that lack of follow through, that was a very eye opening moment for me.
I'm having to like compare and contrast here because even after a knee replacement, we'll have people just touch like on the side of their incision, not directly on the incision because it might still have staples. But even after a knee replacement, I'm in the room within 12 hours. At
Exactly.
the latest is like 24 hours after knee
You're getting
replacement. But
that
we're
range of motion. You're
oh
getting in
yeah.
there, educating. You're telling them how they're going to go up and down the stairs. You're telling them how they're going to get in and out of the car. We're in there. We're telling them so that they can have success. The doctor can be pleased. That type of thing. That follow through. We want good outcomes. Things like that. There's protocols. There's things that you follow after these major surgeries. There's none of that whatsoever. And again, those things are in place for good outcomes. Why is there no concern of good outcomes for moms? We're talking about layers of skin, fat, tissue, muscle, things that have to be restored so that moms and women can function day to day, go back to their jobs, go back to working out, be able to lift their kids, like all of these outcomes in which they need, but there's no concern. And that's the real big difference between the two, which is very unfortunate.
So, but even with that example, a lot of it is because moms are young and healthy. Like they
Mm,
don't need that rehab. That's
mm,
what we've heard. Because when I use a knee replacement, what are you thinking of? An older adult,
mm.
right?
Well, yeah, no, but not all moms are, right? So, like, some moms have had C-sections multiple times. Some moms also have other conditions going on. Some moms also have other pain in other areas. We think we're just putting moms in this bubble that they're in, and not every mom is healthy. Some moms had an emergency C-section, and that's very traumatic emotionally, physically, all the things. And so moms have been placed in this bubble of being healthy compared to an older person with a knee, or even a younger person who had an ACL, whatever the case may be. But there's just a lack of concern or even thinking globally about women and other things that they have going on, so they don't always come out healthy.
Wow. I want to take a moment to just acknowledge our audience. Dr. Catherine Sylvester is joining us, and she has a message I want to share with you.
Oh, awesome.
Because Dr. Jones, I know that you're in the studio with me, so you
Yeah,
can't
I
see
can't
the
see
outside
anything.
world.
Yeah, okay, great. So I'm glad to know people are live. That's great. Okay. It just feels like we're having a private conversation here on my end.
I always try to give you that in that, environment. I do want you to know, like, my attention is on you. But she writes, no one should have to experience what you went through. I'm so sorry. Thank goodness for your revelation in the thick of it. You are saving lives, improving quality of life, boosting mental health, and empowering women because of your commitment to filling the gaps you identified. Thank you for sharing your story so transparently and for being the solution to this problem.
Oh, thank you so much. That's
Dr.
that's awesome. Well, thank you.
It is, and I it helps me. It reminds me that you are sharing, so much of your personal story. So I always want to acknowledge that, and I want to thank Dr. Sylvester for acknowledging that because it's difficult for me. It's difficult to actually hear that it took you going home and looking at stairs to realize no one had really prepared you for either alternating steps, putting
Hmm.
one leg up at a time. Like stairs are hard. And I've worked with women in the hospital after C-section, and it is not easy. Like there's no one technique that works for every single mom. We have had to
Exactly.
try everything from sidestepping and holding onto the rail, from the partner being right there and just providing that compression or that support that the binder really doesn't give. We've tried everything, but to
Hmm.
hear your experience as a physical therapist, an ortho one at that, a personal trainer one at that,
Right.
that's tough. And not many moms, you're right, they're going through several abdominal surgeries sometimes at this point, and every single birth is different.
Yeah. Absolutely.
So if
Absolutely.
there's one thing, and I put this out there kind of in the world before we went on,
Hmm.
I posed a question. I really want you to kind of give the breadth and depth of your answer. Like if there was one thing that you would have a rehab therapist focus on in the hospital room, if they had the privilege of working with a mom before they went home after C-section, what would you want them to focus on?
That is such a great question. And I thought about it because I'm like, gosh, it's so much, right? And because it's so much, and that made me think about the importance of educating on the continuum of care, because it doesn't have to fall on one OBGYN, one PT, one anybody, because there's a whole village outside of day one, right? And I think that, to me, is probably the most important and vital information I wish someone had told me, right? It makes it less overwhelming. It makes it less scary. It make you feel like you're not in it alone. Even on the professional end, right? You don't have to teach someone something, because in the thick of it, especially if it's unplanned, you're not going to remember half of what that PT even tells you, if I can be honest with you, because it's just so much coming at you. But just giving a pamphlet, giving some information on when you get home, seeing a pelvic PT is an option. Being able to have access to a postpartum doula if you need help and you don't have support at home is an option. What are these options that you can have outside of this space right here so that you can get that continuum of care? Working with a pregnancy postpartum corrective exercise specialist if you want to go back to the gym. When you're ready to go back to work, if you need to talk to someone about whatever limitations you have going on, there's other professionals outside of just this hospital and your primary OBGYN or midwife. I think for me, understanding that that continuum of care is even available, that there's options, that there's someone else that you can talk to if you need to. And one of them being a pelvic PT. Like for me, I work with moms virtually. I can see moms after day one. If we need to get on a computer call, like a Zoom call like this, and we can talk about your actual C-section scar, talk about diaphragmatic breathing, talk about what you're feeling right now, talk about your scar, because now you're out of the hospital, you're at home, you're in your safe space. Now let's talk about how we can start healing and improving your recovery at home. So understanding that these people exist outside of day one, I think is just, to me, probably the best thing that you can do in the acute setting, saying outside of here, you don't have to figure all of this stuff out by yourself. There's these resources out there for you.
So I'm going to just try to recap, because this is like very
I know I'm
crucial. You're
saying a lot.
saying not at all. Actually, not at all. You're saying basically, as an acute care therapist, which I think most acute care therapists would agree with this, is that they have to be so embedded in their community or with the social worker or with the case manager, because they have to know who those resources are.
Absolutely.
You're just asking them to use that same breadth and depth of their scope of practice
Exactly.
to apply it to someone after a cesarean section, because we do that for
Already.
every other patient on every other unit in the hospital. We have to know that continuum of care and who to route them to. You don't have someone after a knee replacement only see you and then you're like, hands off, I'm done. You're talking to them about home health. You're talking to them about the equipment that they're going to get. You're working with them on that equipment, and you're talking about outpatient therapy. You're just asking that acute care therapist have those same connections in the community for moms after C-section. Am I right?
That's exactly right. Exactly right. Yeah. And I think that's what I loved about acute, or appreciate about acute care, is because they make those connections. They're getting you prepared for that next step. Do you need home health? You have a whole checklist of things that qualify you for that next step, that next rehab in your continuum of care. And so again, I feel like that can absolutely be applied to C-section moms as well.
You mentioned virtual rehab, and I have to admit, I have actually not come across a lot of virtual rehab therapists, whether they're pelvic health therapists offering virtual rehab like you, who are seeing moms early on. Like, a lot of them are still waiting those 6 weeks. What's the future of cesarean rehab in your opinion? Like, how soon can a virtual therapist see a mom after C-section?
In my opinion, I mean, as soon as possible. As soon as possible, like 2 weeks, 2 days, like whenever, of course, the mom feels comfortable for it. But there's so much education that we can be providing to moms once they get home. Because again, I mean, if we don't have the acute, if the I'm saying the acute care therapist educates, nobody's educating, nobody's there. Well, I'm gonna say nobody, because there are some very rare hospitals that do have PTs coming in, and kudos to these hospitals. Okay, kudos to these systems that are taking steps to bring about change. That's exactly what we need. But the vast majority does not have the acute care therapist, so there's nobody telling the mom about the steps, about holding the pillow over her incision when she coughs, how to ride and get in and out of the cars. Like, that's day one stuff. We can be in there educating moms about how to move better, how to care for her scar, how to start things, gentle exercises in restoring mobility and breathing, diaphragmatic breathing. Like, there's so much to start helping moms connect to their core pelvic floor, just even being just a sounding board, being support. Like, all of those things are so, so needed. And so I feel like from a virtual standpoint, if we're doing nothing but educating and helping moms in that way, it can be so helpful in their recovery and their overall long-term success with their C-section rehab.
I have a personal story. It was a family member that mom, she was in the hospital and I was kind of nudging, like, get a physical therapist to come and help you because it was an unexpected C-section as well.
Mhm.
And a little bit of friction with that, like, no, I'm doing well. But she was using the bed, right? The hospital bed and the rails to get up and about. She was walking. I
Mhm.
get a call at 4 o'clock in the morning, the day after the night. They were discharged and so went to bed at night. I get a call 4 o'clock in the morning from my family member saying that the baby's crib was almost tipped over with the newborn in it because she was sleeping on the couch. She
Okay.
couldn't, didn't have a bed to go home to and
Mhm.
had used the crib to try to get up. And he had to rush over, like he was like kind of in the midst of it, watching it, and kept the baby from tipping over.
Mm.
And I'm hearing you talk and I'm thinking, even if a acute care therapist wasn't there, you
Mhm.
have from day one at home to as long as you need with a virtual health rehab like you, like a virtual rehab therapist like you,
Mhm.
to just look at that situation. And there's a whole bunch of stuff that you could probably do at home.
Absolutely. For sure. Like and so for me, because a lot of people are looking to social media and things like that, I'm like, for one of my first go-tos was making a guide. Like, when I looked out on the internet, I couldn't find hardly any resources about C-section recovery. And again, my daughter's 6 now, so this was 6 years ago. And so once I started looking at, like, exactly what you were talking about, like, those are the type of things I put in my guide, like how to get in and out of the bed, how, like, what are the essentials that you need. And one of them is just a bedside crib. I can't even think, co-sleeper. My daughter's 6 now. I'm like, what is those terms? Just having a co-sleeper right beside the bed so that you're moving, so you don't have to do things like that, right? And so, like, safety, correct setup, having the right things. Again, those are not the things that you're thinking about when you weren't even expecting the C-section in the first place. And so that for me was, I was like, I'm in the thick of it now. I'm going to write down everything I wish I knew, everything I wish I had. And those are the things that I make sure that I educate moms about, because you're right, that in that situation, like, that could have been someone could have educated about her, a better setup for her to make sure both her and baby were safe. So
Let's
that's a
talk about the what if. So say you had a team, you're a virtual rehab therapist, and you have a team that, if need be, they can go into the home. If need be, they're monitoring the mom. And, even there's remote monitoring systems that not only tell you like what your oxygen saturation is, they have remote monitoring, blood pressure cuffs, all of that. You had a team. Who would you want on your team to dispatch, right, into the home if need be? Who would be on your team?
So you mean outside of PT? Like, who would
Outside of PT, exactly.
like
Just
doula you're
exactly.
talking
I
about?
wanna hear, yeah, let's go over a doula and what their role would be. What would you typically want to see a doula doing
Yeah.
during those first few weeks?
Well, so in connection with C-section recovery.
Absolutely.
Right. So even with the doulas that I have personally worked with, some of them will discuss with moms like care. I mean, they talk about the care with their C-section scar and things like that. Some doulas, I know amazing doulas, stay overnight with moms, which I'm just like, wow, that's next level. That is so next level. Like when I learned that doulas, some doulas, not all, offer that
Yeah.
service, I was like, wow, like for the moms who don't have that their husbands or their spouses, they don't even have a spouse, right? Or they're just doing this all on their own. So to know that they are able to come into the home and be there to help mom learn how to take care of their C-section scar, to be able to support them in the other things, because we're telling them don't lift heavy things, don't lift more than 10 pounds. Well, who's going to lift that stuff? That's where your postpartum doula can come in and help with those things. And so when I think doula, I'm thinking at the birth side, right?
Oh,
I
yeah.
never thought doulas, I'm like, that is amazing because it's needed. And so they're filling that space, that gap, that need so that mom can heal. And you're asking moms to heal and not pick up toddlers and do all these other things. So you need that support or that person who can stand in the gap when they don't have that support there. Now, if you have grandma and all everybody, auntie can come and help out, phenomenal. But if you don't, that is, I think, one of the definite people I would have on the team for sure. Of course, you have your OBGYN, your doctors and things like that. I think that's important as well. I'm trying to think of who else would I want to definitely have on the team. Now you have me on the spot. I'm thinking now.
I'm also, you know what? And the lactation consultant for me, when
Oh,
I was
for
in private
sure.
practice, mobile
100%.
mobile practice, it was amazing. I would
Yeah.
get more referrals from the
Yeah.
lactation consultant in the community.
And even so with C-section moms, a lot of moms want to know, like, well, how do I hold the baby so that the baby's not kicking me in my scar? You know, or how should I do like a football hold for this hole? So they have so many questions in regards to that as well. And so I always, lactation consultants are just angels. Because that is such a tough thing. And so even with C-section moms, some will state that, you know, their milk don't come in at a certain time, you know, because of the uterus not contracting or having to push out the baby just like before. And so that will affect their, when they get their milk coming in. So all type of questions that they have, to be able to have that resource, I think is very, very vital for sure.
Absolutely. And so to bring this full circle, I know you talk about cesarean section scar, which I love, like in terms of like massaging. I have had moms, and it's been 3, 4, 5, 6 weeks where they have told me they have not looked at their scar at all.
Yeah.
They haven't used a mirror. They haven't tried to connect with it, touch around it, nothing. They're
Yeah.
scared, and they're also, in some cases, very traumatized
Right.
because in their cases, the surgery was completely unexpected.
Mhm.
When is a when is the best time to introduce scar care after surgery?
Mhm. So for me, scar care can begin indirectly as soon as possible, simply through diaphragmatic breathing, right? And so we know that the diaphragm and the pelvic floor and the core muscles, they're all together. And so getting that reconnection to just breathing, diaphragmatic breathing can just get that scar moving, get that swelling reduced, get things moving, lymphatic, you know, circulation, all of those things from the very beginning. That's one of the first go-to exercises that I teach pretty much all C-section moms, right?
You're saying
And
from the
so
very beginning, like how soon?
as soon as they feel, we all breathe every day. So, right? We all breathe every day. But I say, you know, and I don't like to put pressure on moms. So I make this very clear. Can you start doing it day one? Absolutely, right? But most people are not thinking about that, if I can be honest. So I say within the first 2 weeks, if that's what you want to start doing, some sort of exercise, and you want something that you know you can do safely, gently, diaphragmatic breathing, getting that belly moving, getting that circulation, getting just a reconnection to your core, your pelvic floor, your diaphragm muscles, like that's day one. Then, of course, getting into actually touching the scar, that's going to be more around 4 weeks. You can start to do some things, desensitization. You can start to do some type of scar massage above and below, not on the actual incision, on the actual belly, moving, getting the fascia moving, and then directly on the scar after 6 weeks, making sure everything's clear, you don't have any infections and things like that. So, of course, you can start to do those things during that period of time.
Okay. Dr. Jones, we're streaming live on Twitter,
Mm-hmm.
on LinkedIn, on Facebook, and as well as on Why Can't I Think of the YouTube.
Okay.
For the surgeons who are joining us either live or will be watching this later, there's a lot of misunderstanding for whatever reason in
Mhm.
the OBGYN world. We know that we are on the team
Mhm.
for surgery, and we already talked about ortho surgery, for cardiac surgery, neuro, for all of these other disciplines. We're on the team. We're seeing those individuals within the hospital stay after
Mhm.
their major surgery. For C-section, we covered it. We're not on the maternal health care team.
Mhm.
So for the rehab therapists, they probably have heard this before and agree dogmatically with you. Like there's no argument. For the
Mhm.
surgeons who are joining us, or even the nurses or nurse practitioners or mid-level providers or midwives,
Mhm.
what would you say right now to help them understand why our role early on during the first 6 weeks is more important than after the 6 weeks, after that initial recovery period? What would you share with them?
Mhm. Um, I think for me in discussions with surgeons, like they're heavy on the outcomes, right? So we're heavy on why get therapists in early for shoulder rotator cuff surgery? Why get therapists in early? It's pretty much the same exact reasons because the outcomes are going to be so much better if we start to add in mobility, if we can start adding in um, any type of functional movement, teaching them how to function so that the outcomes of whatever, getting back to work, making sure that their incision is healed well. We're already teaching them about that. So we're basically a part of the team in reducing the amounts of infections, the amount of times moms go back to the doctor, go back to the surgeon because of that lack of instruction not being given to. There's a huge just gap there. And that's exactly where we can fulfill that gap so that we have less rates of infections, less rates of moms having issues with their second and third C-section and future complications down the road. If we want to improve VBAC numbers and things like that, like that's us. That's us teaching moms scar mobilization and all of these things. So if we're wanting to prove the overall outcomes in those areas, that's exactly where we come in.
I worked with a doctor, Dr. Karen Fox, who was a maternal fetal medicine doctor at
Mhm.
Texas Children's Hospital. And she was a pioneer. She was the first surgeon to automatically order acute
Mhm.
care physical therapy after cesarean hysterectomy. So that was
Wow.
removal of the uterus at the time of birth.
Mhm.
And she said exactly what you just said. Her
Mhm.
patients had better outcomes with reducing post-op ileus. So that's where the intestines are not functioning so that women are not passing gas. They're not having a bowel movement. There's incredible pain. And there's always a risk of going back into surgery, opening up that C-section
Absolutely.
incision and having to
Absolutely.
do something major. And
Yep.
so she started actually referring all of her patients to a physical therapist while they were still in the hospital and was noticing a lot better mobility. Therapists were using a walker if mom needed that during their recovery. They were being able to get a shower chair if mom couldn't stand to take a shower. All of those things that you were talking about.
Mhm. Mhm.
That to me is the future of cesarean rehab. We're not going to treat this major surgery like just another procedure. Oh, you just had a baby. You
Mhm.
had a surgery,
Mhm.
right? But
Absolutely.
who's going to fill that gap? Dr. Jones, you're talking about things that an acute care therapist can't do.
Mhm.
It's important that we're embedded outside of our hospitals in this community and with those birth support providers because you may see something as a virtual health therapist that everyone misses, including a doula.
Yeah.
Including a doula. You could actually be watching a mom, seeing her face, she's pale, something's not right, and you can act.
Yeah.
So
Absolutely.
the future of your practice, if you had the opportunity to connect with a hospital and get every mom in the community after C-section at least, if you only focused on that population, what would you want to say or how would you go about connecting with a hospital? Let's pitch right here for the audience and just workshop this before we go off.
Send them to me. No, I'm just joking. It's so funny. I've thought about that so many ways. And that's why I created the resources that I have. Because I'm like, I'm just one person. But if I can give a hustle, I mean, if there's a way for me to get into the birthing classes and have these resources exist. Moms don't have to go to social media to figure these things out, and shouldn't, because it's not all valid information. So there's resources out there. I have resources out there. I can say for what I have, and I pray that even more come. But if
Yeah.
you're looking for education to be able to tell moms how to get up and down the stairs, right? Because the resources are not, everybody can't tell them this information. So giving them a guide, giving them a video that they can watch at home, those are the things that I have created for them so that they can safely transition into this next new world of C-section recovery that they either planned or unexpectedly landed into, like I did, for sure. And
Let's go.
so,
Let's talk about it. This Thursday, April 25th at 7 p.m. Eastern Time, you are actually putting on a virtual interactive C-section scar workshop. So this is part two.
this is
All
part
right.
two.
So this is
Before.
part two. So,
Yeah.
so like for people who are like, oh my gosh, I missed part one, what can they expect just from your workshops? Just so, following you,
Mhm.
wanting to get more information, what can they expect from these workshops?
Yeah. And so the workshop that I'm holding this Thursday is going to be an interactive workshop, just teaching moms, whether they're 2 weeks postpartum, 20 plus years post C-section, how to care for their scar. So the main education that I'm providing is how to mobilize their scar. So what I talked about earlier, how to perform diaphragmatic breathing, what exercises and things you can start doing early on before we even make it back to the OBGYN. And we're talking safe, right? We're not talking going back to the gym. We're not talking about anything strenuous, because the reality is moms are doing exercise, functional movement every single day. So let's teach them how to do it safely. Let's teach them how to care for their scar. And so I'm teaching them exercises that they can do within the first few weeks postpartum, all the way up to advanced scar massage things like cupping. So we're going to be pulling out the cups. We're going
Oh,
to be
yes.
out the silicone scar sheets. I'm going to be educating moms. Up, can you see that there?
Yeah,
Silicone,
that's perfect. Okay.
just teaching moms how to improve the appearance of their scars, how to reduce keloiding, how to reduce hypertrophic scarring, just anything that basically has to do with the scar to get it moving better, feeling better, so that we can reduce those scar adhesions, reduce those secondary issues that can come from a lack of scar mobility, like pelvic floor issues and issues with the bladder, like all sorts of things. We're getting into the nitty gritty, and I'm allowing moms to learn how to do those things with me. And so it's going to be a more interactive. So that's where the part two is coming in. It's going to be a more interactive workshop, and we're going to be doing those things together.
It sounds like pelvic floor therapists could even go to this workshop, because I'm hearing pelvic therapists say, yeah, I'm not seeing them until 6 weeks. So they could probably learn some things
For
too.
sure, for sure. Everyone's invited. Everyone's,
Okay.
yeah. And
This
I had COVID PTs in the last one as well.
Yes. Okay. So virtual interactive C-section scar workshops. You do these throughout the month, throughout the year,
Yeah,
if
so
people
this
are
is
seeing
my
this later.
second one, and so it is recorded, and so people can go to my website to purchase the recording if it is whether you're a new mom or you're a practitioner and you want to learn more about scar massage and how, because even doulas, I've had doulas also take my course so that they can better understand how to help moms care for their scar, and then also how to know what PTs can offer, right? And so they're just learning, oh, wow, I didn't know that PTs could do that. And there's virtual PTs that can help you. And so again, we have to work as a unit and be that village to moms. And so, yes, anybody that needs that education and can benefit from it, they can get the recording if they're not able to make it live.
Okay. It's like you're creating a community-based hospital. That's how I see your role
Wow.
is, yes, you have the doula on your team. You're
Mhm.
partnering with a lactation consultant. You'll call the OBGYN if there's a problem, but all of that care is wraparound care for mom, and it's
Mhm.
offered earlier than she would get it in our traditional OBGYN maternal health system. Am I right
For
about
sure.
that?
Yeah,
Okay.
for sure. Yeah.
So your website, where can people find your courses, your workshops, engage with you, have you as their rehab therapist during their early recovery period, all of
Sure.
it?
Yep. So you can find all of my resources at coreelevationfitness.com. It's completely, all of my services are completely virtual. I offer workshops, I offer guides, I offer programs. So I have an 8-week diastasis recti core rehabilitation program. I'm actually working on a post-abdominal surgery program, meaning for any type of women who've had hysterectomies, myomectomies, C-sections, tummy tucks, abdominoplasty, like any type of things to help them, again, get that restoration, to their cores. Because I've had so many women outside of just moms who've come to me saying that, do I massage my scars well? And then I realized, because I've never had a hysterectomy, I never had a myomectomy myself, and I'm realizing, oh, wow, the gap is bigger than I ever knew. It's not just moms, it's women in general. That are not getting this information. And they are also scared to go back to the gyms and things like that after these major abdominal surgeries. And so I'm putting together a program for that specifically, but you can find all of those resources. I could go on and on, but you can find all those resources at my website. And then to connect with me on social media, my main primary social media is going to be at PT Trainer Shonda, and that's on Instagram. I share tons of education, resources, free things. Like, you can find all those things as well on social media, as well as my website for all of the resources and connecting one-on-one with me through consultations and education calls.
You can't even imagine how happy I am that you are inclusive of women after hysterectomy, after myomectomy, after any uterine surgery, pelvic surgery, because this is that, to me, cesarean rehab opened up a gap into the women's health dilemma. I'm just going to call it what it is.
Yeah.
This is only in women's health, and I can say that having done a residency at the first women's health residency in the United States, and seeing men before and within 2 weeks after their prostatectomy, but not one woman after C-section. No shade. Dr. Jones,
How long you trying to be on here, Rebecca? You know how
you are the future of cesarean rehab. I am so grateful for your time. I can't wait. I cannot wait for, like, honestly, to go to your workshop myself. I'm looking and I'm like, I will look at all of these resources, include them in the show notes so that people just know where to find you. But for me, I need to know what you're teaching, how soon people can connect with you, how soon to refer moms that are in the hospital to resources like you. You're everywhere, 50 states, globally. There's no reason, there's no barrier that someone can't get a consultation with you the day 1 or day 2 after surgery. So this is phenomenal work. I can't thank you enough for your time.
Thank you so much. And thank you for having me. And thank you for bringing more awareness to this. I really appreciate it.
Absolutely. We'll talk soon. Stay on with me.
All right.